All right, so cover your left eye for me and tell me the lowest line you can see clearly. I had my daughter 3 months early, and that completely changed my outlook on the medical field. So she required a lot of care. She was actually in the hospital for the first year and a half of her life, which made me see that nurses and doctors are truly more incredible than I thought they were. So I actually became a nurse prior to legally becoming a nurse because I had to take care of my daughter.
Dana is truly one of a kind. It's one of those things where you see who you're working with on the schedule and you just take like a sigh of relief because you know it's going to be a good day regardless.
You can truly learn from each other. It's not just about title, it's really about working together and what you know how to do. And if you're confused and don't know how to do something, your coworkers always have your back.
Wound care is done. Dr. Sefi said he put a script on the chart with the wound care order.
Oh, amazing. Okay, great.
I started with Inspira about 6 years ago. I started as a nurse assistant, and I was at the Woodbury facility. So once we opened up here, I transitioned over. I got my nursing degree, so I've kind of been able to like develop career-wise, and I felt like it'd be a great place to grow professionally as well. Today we're on 4th floor on the west side. So this is a step-down unit. Patients are usually a little bit more sicker here and require a little bit more care. Today's my last shift on the floor as a floor nurse. Next week, I'm transitioning to an assistant manager role. I think if you want to get into it, just try to get your foot into the door and interact with the patients. And I think that way, you'll really see the difference you can make on people. And that's how you know if you want to do it or not.
How you feel? You feel it all or not?
Yeah, I still feel it.
You still feel it?
No.
Pain or feel like it's pressure?
I got pressure.
Pressure, okay. I've been a nurse at Inspira for 15 years now, 14 of that as a nurse in the emergency department. I was in Violin for many years up until 2022, and I started bridging here from 2022 till now in the emergency department. I love the ER because I came from an EMS background, so I like the diversity. I don't like an office job 9 to 5. I like coming every day. It's something new. It's fast paced. You're always going to see something different as well. But it's also the team you have here also. So when you got something come in, everybody works together, they jump in together.
Ryan has been a longtime nurse in the emergency department, and he's kind of been a staple here. He's well known for being somebody who has a great sense of humor, and he really does embody what it means to be a good team player. He's fantastic at driving morale up, which I think helps improve team dynamic for sure. And also, I think as a result of a good team dynamic, we have great patient outcomes because of that.
I think nursing is important because in this field, you get to help a lot of people. You see a lot of people in the worst days of their life, and you get to kind of help them break past that barrier, make their experience a positive one. I think nursing goes beyond medicine, it goes beyond diagnoses.
Happy Tuesday, this is Christy. How can I help you? Oh no, Helen, I'm sorry to hear that. Can I have you verify your... I work with one of the specialty offices to triage patients, to talk to patients with any clinical concerns, to refill medications, and just to support the office staff, including the physician and the nurse practitioner in any way that we need to. So when I started nursing almost 30 years ago, these kind of positions most likely would have been a nurse in the office, but that would have limited a nurse to one office only, whereas moving to telephonic and work from home, we can support multiple offices at the same time. We can field calls from different specialties, from primary care to women's health to endocrinology like I do.
Christy goes above and beyond for all of the patients that she comes in contact with. She is a team player, always willing to jump in to help any team members at any point. She makes sure that she handles every piece of the call and concern when a patient is in communication with her.
Have you ever had to be sedated for an MRI in the past?
Not that I recall.
Okay. So a couple of questions. Some of the questions might seem kind of strange, but
teaching was actually my first career. I was a teacher for 11 years before I decided to transition into being a nurse. So for me, teaching incoming nurses that are young or new to the field was very important for me. I remember being new to the profession, and I felt like for new incoming nurses, they need someone that they can trust and be able to talk to, ask a lot of questions to, and that someone to patient with them. So I feel like for me, it's second nature to help and to teach along the way in an environment that can be overwhelming and stressful.
So Erin's great. I feel like she's the perfect preceptor just because she has a teaching background. So she's very eager to teach new grads the ropes of things and how to be confident in your skills.
It's always a good time working with Erin. I started with her over here on D side in the ER, and she showed me the ropes a little bit, showed me where things were, and did it with such kindness and gentleness that I just really appreciated.
Nurses aren't just nurses. There's a lot more into it, and you have to have that feeling in your heart to be a nurse.
I love being a nurse because I love the difference you can make in people's lives, especially when they're at their most vulnerable. It's the most rewarding thing when you see them leave those doors feeling better.
So nursing is important because it's pretty much the backbone of the hospital too. I love nursing for that reason.
I don't think you'll find anybody in healthcare who went into it to not help people.
You are their therapist, their mother, their father, their friend, their family member. It's something you take on every day. It can definitely be a heavy job, but it's also very rewarding.